Hello, for this week's tutorial, we're going to be covering concepts associated with the male pelvis. So specifically what we'll be looking at, we'll look through the axial orientation slices of a pelvis. So we'll hit on some general anatomy, anatomical structures regardless of gender that are present. So really some of those bony structures, but then we'll get into some of the male specific anatomy here as well. So just to kind of go through the information, you can see here are our standard four windows. So we can see the axial orientation, the sagittal orientation, the coronal orientation, and then traditional scalp-based image just for the localization. So right now we're at kind of like the superior aspect of the scan, and this isn't just the pelvis, it's an abdomen pelvis, so there is quite a bit of abdominal tissue and abdominal structures in here as well. But as we can kind of continue to scroll down, we can tend to think about the pelvis as being an area or region that starts with the iliac bones. So when we get down to the ilium, well, that's where we'll start talking about some of these structures here. So as we kind of continue to scroll down, you can see some of the bowels here. You can see the psoas muscles on both sides. And then you also can see some vessels. So in this regard, what you're seeing here would be the inferior vena cava, and then what you're seeing here would be an example of the abdominal aorta. And right here you can actually see that abdominal aorta bifurcate. So where the points that it bifurcates would be just referred to as the iliac arteries. So right iliac artery, or right common iliac artery, and left common iliac artery are reflected there as we kind of continue to go down. So that's, kind of the first thing to kind of note. That's right around the region of the pelvis. You can see the pelvic bones, being demonstrated here. So you can kind of think about this, the first pelvic bones that you see as being equivalent to the iliac crest, the most superior portion of the pelvis itself. So you can see those regions here. And then additionally, you can kind of see those regions that are associated with the anterior superior iliac spine, so the ASIS versus the PSIS there, and also the formation of the SI joints on both sides of that sacrum that's being present there. So as I kind of alluded to in the initial lecture, here is that what I consider can be kind of like that raccoon face. You can see the sacral foramina there, and the sacral canals are demonstrated on both sides are the SI joints there. So it's pretty interesting, I think, to be able to look at it in that regard. But the bony structures themselves are not crazy challenging because they're very consistent with, I think, what we tend to think and what we already know in terms of our learning progression. So as we kind of continue to go down, you can see that the sacrum, or at the point of the SI joints, we're getting more and more narrow. So we lose our SI joints, that articulation is not taking place. And as we continue to kind of go down, you're looking more at now that transition into the coccyx region. So you can see the coccyx, there, and gone. So then we're out of bone in that regard. So you can kind of see that transition taking place. And those sharp little points are just like the cornu, so the sacral and the coccygeal cornu are what's being demonstrated there. Other bony-based structures that are present here. So again, this doesn't matter male versus female. But you can kind of see right here is the roof of the acetabulum. And as we kind of continue to go down, what we'll be able to see and demonstrate, and of course, if we changed our window, we could be able to demonstrate some of the bony processes a little bit better than what we're seeing here with the abdominal pelvic window. But you can see the femoral head there. So femoral head, you can see a portion of the greater trochanter, and you can see the neck. So the patient isn't perfectly aligned on the table by all means, and that we're not seeing those symmetrical appearances of structures, but nonetheless you can see those structures. And the other structures that are being demonstrated here, you can see the symphysis pubis on the anterior side here. So of course that would make these pelvic bones, and then kind of on the back side of things, you can see what would just be classically referred to as the ischial tuberosities here on the back end of things. And what's cool is, so we're seeing this separation of bones here. And it's, yes, based on the slice that's taken, they appear to be separated. But in the reality of things, these bones are connected. If we look on our localizer and see where we're at, you can be able to say, all right, so that has a space right there. So what you're being able to see is the region of the obturator foramen. So it's just that the opening is there. So you can see kind of that connection there down here in the inferior aspect, some more of the anatomy truly associated with the ischium. On the anterior side, we may still be looking at the inferior ramus of the pubis here, but nonetheless, you can see kind of that formation of that obturator foramen. You can see it's connected, it's gone, and it's reconnected. So if you kind of imagine it in 3 dimensions, you could see that circular like process kind of taking place there. Additionally, just to kind of focus on some of that femoral anatomy, yes, we highlighted and emphasized the greater trochanter there, and you can see it there subsequently on the contralateral side, the left femur there. As we kind of continue to go down, though, we can see almost the start really of the lesser trochanter being starting to be demonstrated there as well. So in terms of just true male anatomy, you know, the important structures, of course, are going to be to understand the prostate gland and the seminal vesicles. So you can kind of get a sense of where we're at, utilize these tools to your advantage to kind of say, all right, I get it, I know where I'm at. So we know what we covered before. You'll be able to see the bladder, and you can see the bladder, the formation of the bladder. You can see the rectum back here on the posterior aspect here. As we continue to go down, there's that bow tie right in there. So basically the formation of the seminal vesicles with the vas deferens being kind of in the center aspect of that. So seminal vesicles, bladder is anterior to that, rectum would be posterior. This patient's rectum is easier to identify here because of it's being air filled, so we can be able to see that, you know, quite well. And subsequently, kind of as we go down, what we should be doing is we should not be demonstrating the bladder as much, but we should be demonstrating the prostate gland. And the prostate gland is demonstrated right here, immediately anterior to the region of the rectum. So as we kind of continue to go down, you can still see the prostate gland. And this patient's prostate gland is actually relatively small, but you can see somewhat, if you use a little bit of your imagination, just remember that the urethra is right in that center aspect of that region. So you can kind of be able to see that there respectively. Aside from those structures, of course, you can see kind of the origin of the penis here, so you can kind of start to see the start of that. But aside from that, you know, those are the structures that I'm really going to hold you accountable for going forward. So just in terms of the male anatomy, definitely be able to identify the prostate gland, seminal vesicles, urethra. Of course, yes, the bladder, the rectum, understand their proximities and general locations in addition to some of those other basic structures there. If you have any questions about any of the male anatomy, be sure to let me know.